Thank you. Giving me the chance to present the Ethiopian viral hepatitis care and COVID-19 response context. So uh, I will go to directly to the epidemiology of viral hepatitis in Ethiopia. And I recently conducted systematic review and meta-analysis. The pool prevalence of hepatitis B was estimated to be like 7.4%, and that of Hep C is like 3.1. So this is in a population where we have 110 million people, the second largest nation in the African continent. So we have a huge number of viral hepatitis. And the recently conducted population-based cross-sectional hepatitis B seroprevalence study by the Federal Ministry of Health, which is unpublished technical reports, estimated like 9.4. So, cognizant of the failure to respond to the 2012 WHO request for member states to provide key strategies for prevention and control of hepatitis B and C and other viral hepatitis, the Federal Ministry of Health has developed the first strategic plan in 2016, and that has got like 5 strategic objectives. So the first is to set policies and strategic plan, which have been already done, and prevention of viral hepatitis, creating access to testing, medical care and treatment, and developing and strengthening an information system in relation to the viral hepatitis program, and increasing awareness and public mobilization were the 5 strategic points. So then that document has set out the hepatitis policy planning and hepatitis policy and planning. And the first is to establish a national hepatitis program, which was not yet established, and providing guidance and ensure laboratory service system. So making sure that the regional and the central reference laboratories work with standards and accessible for Hep B and Hep C and treatment and care, promotion of research and integrating and strengthening the program into the existing programs like HIV and MSH programs, establishing technical working groups, which was already established and functioning, which is expected to provide and assist the federal the ministry in policy formulation and implementation. And the other is developing a clinical management national guideline, which was initially developed in 2016, just right away after the strategy. And the second version is under revision and it's available on hard copy. So the last point is to build a program in already existing regulatory procurement and supply chain system, which is not fully integrated in these existing programs. So in the sideline, the ministry has done preventive efforts like integrating the Hep B vaccine as a part of EPI program, and closer 68% of the infants receive Hep B vaccine. And one of the strategies is to start the birth dose Hep B vaccine. But it's not done at a larger scale. But since recently it has been tested in some pilot sites, and hopefully it will be coming to a full scale, and other screening initiatives, increasing awareness program have been done. So the major challenges in scaling up hepatitis testing and engaged to care is, even though the ministry has developed an ambitious strategy that lacks implementation, the program is not well, I mean, it's not established yet. This is because of the lack of commitment from all national and global stakeholders. And the financial issue, initially the assumption was reliance was on the national health insurance scheme, which was not fully functional to operate the program at a full scale. Initially, the estimated total cost by the ministry to run the program for 5 years, starting from 2017, was closer to 87 million USD. So if you see the cost of diagnostic and treatments in our country, a third world country, where especially in the private facility, the rapid test may cost like 4 USD, and the PCR may cost like 127 USD. And the treatment is also expensive, as you see here. So other competing agendas like for tuberculosis, HIV, malaria, MCH services, and the pandemic non-communicables are also the major issues that are we are facing to go with such a kind of programs. When we come to the COVID-19 African situational report of WHO to date, Ethiopia counts in fifth in the continent, and to date, more than 1.2 million tests have been conducted, and more than 1,000 deaths have been recorded. And if you see in the graph downstairs, the number of cases have been increased since recently because of most increasing number of cases. So we don't know the actual dynamics of direction of this pandemic so far. So in the initial phase of the pandemic, there was near total disruption of care of all medical and surgical services. Patients were disappearing from follow-up, the discontinued medications, and then monitoring schedules because most of the patients are living far away from the major towns where their service is not really available. And ministry has worked aggressively to mitigate this problem, largely through teleclinics, media, and reassuring patients to come to visit the medical and surgical services. So far, there are still shortage of drugs, lab tests for hepatitis and treatment for obvious reason. And lastly, I'll present a case discussion of a patient with COVID-19 and Hep B co-infection. It is a 50-year-old physician of my colleague who is chronic liver disease of Hep B and on antiviral treatment for the last 7 years with durable viral suppression and recently developed symptoms of fatigue and alteration in mentation, and eventually he was tested for COVID and became positive and developed marked desaturation. And his chest X-ray imaging revealed bilateral ground glass opacity, and he was transferred to the COVID center, and subsequently has been intubated. He finally expired after 1 week stay, and he was not able to make it. And this is to show you how it affects us. In summary, viral hepatitis and this burden are getting very little attention in Ethiopia and the other low-income countries. The level of technical guidance and financial support from the international community is very low. Implementation and strengthening of viral hepatitis program needs major emphasis. Leveraging the successful health extension program for hepatitis response is very important, and exploring ways to learn from and integrate into the HIV/AIDS program and maternity programs should be considered. Test and treatment cost is so unaffordable in a country like us that requires strong public-private negotiations to reduce cost and provide service access. So the care of viral hepatitis has been affected markedly by the COVID pandemic. So my take-home message is we have a huge burden of viral hepatitis. So we need to come out from the pandemic, and we need to work very hard to address this number of people to test and treat, as we see many patients developing hepatocellular carcinoma complications related to liver that requires a global support. Thank you.